Hi, I'm Mick Falkel, Chief Medical Officer here at OnPharma, and I'm really excited today to introduce you to Dr. Chauncey Wagner. Dr. Wagner sent us an incredibly compelling email on how she's utilizing buffered anesthetic during the pandemic. Dr. Wagner?
Hi, Dr. Falco. Thanks for having me. I'm so happy to be here.
Great. Well, thanks so much for joining us. What compelled you to send us that email?
Well, gratitude mostly, and I wanted to see if maybe we could share this information with other dentists because it's helped me so much. Actually, I don't see how I would be able to practice without it right now because of the PPE requirements. So having to put so many things on and then use it for a single patient and then take it all off after leaving the room. So what I've been doing is getting, all dressed up in the N95 mask, and then over that I wear the level 3 mask and my loops, my gown, the face shield, and then go in and then get the patient numb, and then I wait there for them to be numb because you wouldn't want to leave the room, and go, like if you had a hygiene exam, for example, you wouldn't be able to go take everything off and then go into the other room. I think those days are over for a while in dentistry, the room-to-room dentistry. So with the onset, I go in, I get the patient numb, and they're immediately numb, unless I miss, and then it's only 2 minutes, and you missed, and then I haven't missed the second one yet. So yeah, it's been really, really helpful.
Well, fantastic. What kind of patients have you been seeing during the pandemic?
I've been seeing emergency patients with some pretty severe emergencies, mostly charity for the Medicaid patients. None of the community clinics have been able to stay open because they don't have the PPE. So I've been seeing them, so they've been coming in pretty infected, and even with all that infection, I still have 100% success with getting every single one of them numb.
Wow, that's fantastic. So let me ask you this. How do you see yourself coming back from the pandemic? Because we are getting close to that in many states. You being in Washington, me being in California, maybe we could be some of the last states to resuming to some sort of new normal. What do you think that new normal looks like for you?
Well, I've heard we have to keep every operatory empty for 3 hours between patients. So I have to work that into my schedule. But I have figured out a way to get my hygienist back with doing that. So what I'm planning to do is having her work for 3 operatories, and I'll be in 3 operatories. And as far as the onset, getting all the PPE on, then I'll go into the procedure, whatever I'm doing, get the patient numb, do the procedure, finish with that patient, and then leave, get rid of all the PPE, wash up, and then get new PPE on to go in to do the hygiene exam. So it's going to be pretty intense with all the PPE.
So it sounds like you feel like the days of bopping from one room to another, in and out, like all of us have practiced for all of these years, kind of because we had to, maybe coming to an end because of the pandemic.
I do think they're coming to an end. I think it'll be at least a year where we have to, be really careful. So, and who knows, maybe forever.
Well, I'll tell you, it may be the thing that the long-lasting thing that comes out of this pandemic. So with that, is there any last things you'd like to tell us about your experience? Because you've been fantastic, and I really appreciate everything that you've done to help make people aware of how they can mitigate some of the complications and new protocols that we have moving into the future.
Well, another thing I would like to say about the onset that I really like is just how simple it is to use. That I really like that. I feel like I have so much in my brain, to be honest, that I have to, keep track of. And so learning something new, it was really nice that it was really easy. So I have it here if I can just show you. Basically, you just put the cartridge in, and then it goes in, and then you switch it, dial it to 9, push the button, take it out, you're ready to go. I mean, that's just so quick and simple. I really have appreciated that about the onset as well.
Great. And then, you also have the choice of using all the anesthetics, which is kind of nice.
Yes, yes, that's been really nice as well. Because I do like to use the Articaine sometimes.
Well, fantastic. Well, thanks so much. I think contributions like yours are really going to help dentists and even more importantly, our staff and our patients moving forward. So thank you, good luck, and I really appreciate everything, and take care.
All right, you too. Thank you so much.